double lung transplant on May 5th. Next week will be 6 months ago. I really didn't have any symptoms until I started my first year of high school. I noticed that when I would go to PE, I wasn't able to participate like my friends in the sports or the activities the teacher had us do. And that progressed over time. I started getting worse and worse, short of breath, very tired. Then my sophomore year, I just avoided PE as much as possible. I tried to get out of it. And not because I didn't like the class, again, because I just couldn't do what the teacher was demanding us to do. My grade went down to a D, and that's when my parents got worried, because I'm a pretty good student. I would get good grades. I liked school. And I told them how I was feeling, I can't do what the teacher's asking me to do. They thought I was just being, lazy teenager and didn't want to break an nail in PE or whatnot. So they made an appointment with my pediatrician, and she said I had asthma. So she prescribed some inhalers, and they did not work at all. I felt the same. I didn't feel any different at all. So then I catch the flu, again, when I was a sophomore. That progressed into pneumonia, and then that took me to the emergency room because I was coughing up blood, I couldn't breathe. I went to the emergency room at Chalk here in Orange County. The doctors did the x-rays, and they certainly saw something was terribly wrong. They suspected a lot of diagnosis. So then they did a lung biopsy so they could confirm what I had. And they diagnosed me with pulmonary fibrosis. I don't know, maybe you guys have heard of cystic fibrosis, which is you're born with. I was not born with mine. It was idiopathic. They don't know how I got it, where it came from. When it started, nothing. They had no clue. They just said, we need to see how we could control it. Pulmonary fibrosis has no cure, so basically what it is scarring of the tissue in the lung, so it progresses until you damages your lung tissue, and then you just can't breathe. So I spent about 3 months in the hospital when I was diagnosed. I was 16 at the time. So then they gave me steroids and other medications to control the disease. After that, I managed pretty well with it. I graduated. I homeschooled because they thought that I was too sick to go back to school, and I was very immune suppressed, so any flu or an infection would be life-threatening. So then I got better, and they let me go back to high school my senior year so I could graduate with my class and my friends. After that, I went on to college. I was living, I think, a pretty normal life for my age. I mean, I got my first job at Disneyland. I was going to college. I was, managing my doctor appointments in between, treatments, a little pneumonia here and there. So after that, I accomplished a few of my goals. I became a nurse, which was part of my goal. And I got my first job here last year in March at St. Joseph Hospital. I was working the night shift, and a little bit after I got hired, my boyfriend proposed to me, so I was juggling my wedding planning and my night shift at work, and I was feeling really bad and really awful, and I thought, it's just a phase I was going through. After all this is gone, the wedding and everything, I'll get back up, and my body's just getting adjusted to my new job working night shift. But I was wrong. I was getting worse by the day. And 5 days before my wedding, I went into the hospital again because I just couldn't breathe. And my pulmonary doctor, which is Michael Fox, who's a great doctor. I've had many pulmonary doctors in the past, and I can honestly say that he's one of the best doctors that I've had, and he cares about me so much. So he told me, we've done what we could. We're just a lung transplant is the only way you could get better or you could save your life, because there's no more, there's nothing I could really do. There's no more medication we could do, nothing. So I was on oxygen 24 hours. He started me on 6 liters of oxygen. He recommended I postpone my wedding, and I was like, no, I knew I was going to get worse by the day. I could still walk, even though it was difficult to breathe. So I managed to come to an agreement. He let me go out of the hospital on a Thursday, so I got married on Saturday. No traveling, he said. I had to see him on Monday right after my wedding and start the lung transplant evaluation. So we started here at UCLA. We started in December, started doing all the testing and all of that stuff. And I was just getting worse, so by February, I wasn't even able to stand in the sink to brush my teeth. I couldn't dress myself. I relied on everybody for help. My oxygen went up to 10 liters, 24 hours. So after that, I went into the ER again because I just couldn't breathe. I couldn't bear with how I was living. So they took me to UCI here in Orange, and they intubated me right away. I was not being very compliant, so I took out the tube twice, which didn't help. That caused my right leg to collapse. I went into respiratory arrest, and they performed CPR. I was giving a dose of epinephrine, to bring me back, and they managed to bring me back, and they transferred me to UCLA so I could get better and get on my name on the donor list. So when I went to UCLA, this was in February, I was in UCI, so by March I was at UCLA. They transferred me over, and at UCLA they did a tracheostomy. So it's a tube that goes through your throat, and it's hooked to the ventilator, so it could help you breathe. In my case, it was basically breathing for me. You can't talk, well, at least I couldn't talk with the tube, with the trach, and I couldn't eat, so they did a G-tube, which is a tube that goes to your stomach and it feeds you. So I had that, and they just kept telling me, you need to get better, you need to get stronger for transplant. We're trying to get your name on the list, and I kept fighting, and they came back with that my insurance, which is Cigna, did not want to pay for my transplant at UCLA, but they would pay for my transplant if I was transferred to UCSD, which is in San Diego, which does not make any sense at all, but whatever they had to do. So it was too risky, or I was too sick for them to transfer me to San Diego in an ambulance. So they flew me there. They flew, very uncomfortable situation. I was very scared, so they flew me to San Diego. I was in March in UCLA, and by April I was in San Diego. And then there I met a different lung transplant doctor. His name is Dr. Gordon Young, who's also an excellent doctor, cares for his patients very much, and I'm very thankful that I'm his patient. And there he said that now my insurance was telling them that I was too sick for transplant, so they didn't want to pay for my transplant. So, and plus, he also said that it's rare when they put patients that are on a ventilator on the transplant. So, because I was so young, he said, I'm going to keep fighting for you. We're going to get your name on the list regardless. I'm going to keep trying. Don't give up, keep trying, keep doing your physical therapies when they come in. So, yeah, I would just keep on trying. She would come in. They have like a portable ventilator, which they would hook my trach to the portable ventilator, and I would walk with the ventilator on. And I just kept fighting, and then he came back and said he managed to speak to the CEO of my medical insurance. He was trying to convince them, to give me my transplant, but in the meantime, I could no longer wait for that to happen in intensive care, so I guess it was too expensive for my insurance to keep me there.